on?
I think so.
Oh, I didn't realize it was all of us.
Yep.
All right.
It works.
Here we are.
Okay. So this is our first episode of going live, where we'll be featuring birth businesses throughout the community, and also just discussing some tips and things for your pregnancy and postpartum and all that. And obviously we have a baby with us.
Yes.
So
Brand new Leo will be with us during these sessions. So today we're here with Hackney Chiropractic. We're going to ask them some questions about prenatal care and also care that you can receive postpartum and also for your little babies. Please feel free to post questions. I'm sure they'll be happy to answer any questions afterwards. So,
okay, so our first question, we want to discuss Webster certification. What does that mean? Are you both certified, and how do you know if a chiropractor is certified, and why is it important?
Those are a lot of great
It's a lot.
questions.
It's a lot of questions all at once.
No, they're all good.
Let's introduce ourselves.
Yes, please. Sorry. This is
I'm Dr. Daniel,
I'm Dr. Josiah.
and we're here with Hackney Chiropractic. And so the first part of the question was,
What is
the-
Webster?
yes.
So the Webster technique was designed by Dr. Larry Webster, who's a chiropractor. And the goal of the Webster technique is to help balance the pelvis and the sacrum, the muscles and ligaments that attach in that can affect
Pregnancy, labor, birth.
optimal positioning and things like that.
Yeah.
So we are both Webster certified. The best way to find out if a chiropractor is Webster certified is through the ICPA website.
ICPA 4Kid, the number 4, ICPA4kids.org. You can find a Webster certified chiropractor there. So as chiropractors, we're trained to take care of everyone. If someone has the Webster certification, then they have additional training. They have taken time and invested time and money to learn even more how to take care of pregnant mamas.
Mhm.
And that's what we've done.
Yeah, and we love doing it.
Also, we will link all of the info provided during the videos later on for anybody who's interested. So the
Good.
website,
Yeah.
things like that, their info, all of that will be linked afterwards. Do you want to?
yeah. Okay, so this is a pretty great question, especially because you guys helped me with this, but alignment during pregnancy, how it can affect your birth, your body, and obviously your baby. It was really big for me to make sure that baby Leo stayed in a great position.
Yes.
So if you can talk about that to moms, I know a lot of us go through misalignment during pregnancy and don't even know like how much it can help just seeing you guys every week.
Yeah. Well, we just so happen to have a spine.
I'll scoot over so you can get it in.
This is your spine, not yours, but a spine. What your spine looks like. I'm gonna go through.
Yeah, so with the Webster technique, we start in the back. We start by balancing the pelvis and the sacrum, which is very important, and proper alignment and motion of the pelvis. Since the baby goes through the pelvic inlet, we want to make sure that everything is moving the best and optimally, so that it gives mom and baby the best chance to have the birth outcome that they want. If there is a misalignment of anything, whether it's the sacrum or the pelvis, it can narrow that inlet, making it more difficult than it could otherwise be.
Yeah. I'll just give you a close up. So this is what we're talking about, the sacrum and the pelvis. This is what baby passes through. Sometimes in this position, sometimes you're in this position. Doesn't matter. So we want to make sure.
Very rarely inverted though.
Yeah, not often is a baby born this way. So we want to make sure that the hips are in proper alignment, because they come together and form this pubic joint here in the front. And so a lot of times when this is off, you're going to get some of that pubic bone pain, and then the round ligaments attach in here. And so if it's off, it's going to create more tension on one side versus another. In the back here, the sciatic nerve runs down through here. So if this is off, then it's going to affect that nerve and can create some of those lovely pregnancy symptoms.
Yes.
Perfect. That's cute.
Thank you.
A nice little handling. Yeah.
We should name it. We should.
Yeah.
If you guys have
Name
suggestions for
suggestions.
names.
Yes.
I thought we had a
Name the
for it.
spine. We're
Yes.
good.
Fun little going loud.
That would be great.
Okay, so the next question kind of piggybacks off of that. Why is continued care so important?
In pregnancy specifically?
Yes.
So a lot of changes are happening in the body. body during pregnancy. And anyone who's been pregnant, I'm currently pregnant, knows this to be true. You have relaxin, which is your best friend and worst enemy at the same time. So relaxin is an amazing hormone that does what it says. It relaxes the ligaments and gets your body ready for all those changes. It actually starts pretty early on in pregnancy, and so we have things shifting and moving. And just because we live life, especially if you have another little one you're carrying, or you have a job, or really anything other than, well, even laying around is going to affect your like, just life affects our spine and our pelvis. And so we want to make sure that we're making these changes and keeping everything in proper alignment throughout the entire pregnancy, because that's going to set you up for success for later, instead of waiting until 35 weeks and then you have the bad sciatic pain, or you find out baby's not in a great position, or whatever.
Yeah, that's awesome. Okay, so this is another really great question for us to ask. So talking about baby, I mean, I bring a baby Leo to you guys to be adjusted. Why is it so important for your newborns to be adjusted? Talking about kind of how birth affects their spines, their little tiny spines, and how you guys can help with a lot of different things that babies go through.
Yeah, absolutely. So we like to point out that an adjustment on a baby is not what you think it is. So you picture, oh my gosh, how would you do that with my baby? You know, like twisting the neck or cracking things here and there. It's actually a very gentle process. Whenever babies come in and they're sleeping, usually they'll sleep through their entire adjustment, because the amount of pressure it takes to make an adjustment in a baby is just a few ounces. So if you imagine how much pressure you use when you check a tomato to see if it's right, that's about the amount of pressure it takes to make those adjustments.
That's a good example.
Yeah, so it's very, very gentle. On the flip side, when they're born, there's about, it's a range, but around 60 pounds of pressure per square inch put on their neck during a normal birthing process. And then
that's in the perfect birth.
Yeah,
If
so
there's any interventions,
if we had to
or-
have some interventions,
Right.
forceps delivery, a surgical birth, where they make the incision and the way baby gets out is they'll use their little neck just kind of as a lever to bring them out. And so that's a lot more pressure. So we recommend every baby be checked just to make sure. I'm gonna come close again.
Get close.
Yeah, so we adjust the spine, but it's really to affect these nerves right through here. So in little babies, a lot of times the upper neck, we want to make sure everything's moving properly there, because those nerves go up into the head. Nerves down here go to the tummy, go to the colon, and so common things that I see in the babies, and it's not that we're treating any of these conditions, but common things that we see when the body's not able to function properly. Maybe difficulty feeding on one side. So if they have a misalignment in their neck and it's uncomfortable to turn from one side to another, then they're going to prefer one side. And there's not a big difference from side to side for most women. So it's not that this is the best side, it's that it's uncomfortable to turn to latch to this side. So that's in the little bitties. I see a lot of latching issues, and then as they get a little older, colic, constipation, reflux. Yeah. So those aren't things we treat, but those are things that the body's trying to communicate something's going on. And so chiropractic is a great place to start because it's not invasive, it's very gentle, and a lot of times making those adjustments, the body's able to heal itself, and then that will either greatly improve, if not resolve, that issue that they're having.
We're trying to help the body function optimally. And when the body functions optimally, a lot of times those symptoms go away. So
Yeah, that makes perfect sense.
Yes, it does. So, talking about after baby, postpartum recovery with chiropractic care, how is it effective and why is it so important?
Yeah. So after the baby's born, we recommend, if it was a natural delivery, then we've had moms come home from the hospital, or we do visits as well. If they had a home birth, to kind of take care of mom and see how everything's doing. So there's really no limitation other than mom's comfort in the beginning for them. And the reason why we want to make sure that everything is balanced after the baby is, and I'll show this. So as the pelvis opens,
It needs a name.
Please name our spine.
as the pelvis opens, it doesn't always perfectly come back together again, and so typically some minor adjustments are made after the baby's born, especially if the mom's been under care during the pregnancy. It's usually a pretty smooth transition for them. And then a lot of times, if there's discomfort for the pregnant mom, it'll be in the low back and the pelvis during pregnancy, and then after the baby's born, when the mom starts breastfeeding, the pain moves to the upper back and the neck. And this is because if we're in this position for a long time, it's just adding extra pressure to our upper back and our neck part of the spine versus the low back and the pelvis, which is where most of the weight was being carried during pregnancy. So just making sure everything is balanced is going to give mom a good chance of enjoying those, the time with baby. So, which is what we want. We don't want it to be a painful process or
No, it doesn't have
uncomfortable.
to be.
So,
Great, that's awesome. So we're talking a lot about the spine. Obviously, it's what you guys work with the most. So your spinal column obviously is protecting our central nervous system, which is not just important for pregnancy, but it's important for your whole life.
Right.
So, kind of our last question would be like, why is chiropractic care so helpful outside of pregnancy? You want to keep coming to you guys to just make sure that everything's functioning normally. So, can you
Yeah.
talk about that for a little
Right, because we both get adjusted, but only one of us is pregnant.
and it's not me.
And it's not Daniel. But Daniel is still living life. And as a chiropractor, he's not immune to the stresses on the spine. So whether you have a desk job and you're sitting every day, or you're very active, oh man, or you're very active, or you're momming, just all of those things are going to affect the spine. And they're little micro traumas. And so it doesn't have to be that you were in a car accident, or that you had a major trauma playing
Fall or
sports or a fall. Those definitely affect your spine. But just the day-to-day life affects the spine because the muscles attach into it. And so if we see a lot of hairdressers. So if they're in this position all day, that's going to affect these muscles, which then attach to the spine. It's going to affect the alignment of the spine, which then will affect those nerves. And so sometimes it shows up as pain. We get some discomfort in this area, but those nerves control everything. And so sometimes it shows up as a tummy ache. Sometimes it shows up as constipation. And all those are just ways your body's telling you, I'm not quite functioning at 100%. And so we love taking care of pregnant mamas, but everybody should be checked to find out how is your spine functioning, or how's your spine aligned, and how are those nerves functioning, because that's going to affect everything in your life.
Yeah. We try our best to figure out the profession that you have, if there's anything that you're doing day to day that is upsetting your spine. Like if you have a desk job and your monitor's down here, your neck is probably going to have some discomfort if you're looking down all day, or if your chair is too low. So making some ergonomic recommendations makes a big difference to help hold those adjustments even longer, which is our goal. We want your body to hold the adjustment for as long as possible.
And go live life.
Yeah, have fun, have a good time, and
That's great.
I think that's a good point, because I remember coming in after Emily had her baby, and I was just so sore from attending the birth, and we were making jokes like, who's sore, who did the work, and I needed the adjustment. My husband, he comes in for knee issues, and I have allergies, and all of that has been helped by coming here. So it's kind of a huge, broad thing that you can receive help with.
Yes. I mean, the
When in
spine
doubt,
is
go to the
definitely
chiropractor.
Yeah, when in doubt, just asking.
Come here first.
Yeah.
See if this can help.
So Dr. Daniel, Dr. Josiah do assessments for you when you first show up. They will assess everything that's going on, watch the way that your body's functioning, and it kind of helps them get like kind of a snapshot, right, of what's going on in your body and how they can help. And then they give really great advice about just, changing little things that you do during the day just so you feel better, and it makes a huge difference how your spine is functioning with your nerves and the rest of your body. So we have several different systems in our body, but they're all connected, and definitely the spine and the nervous system, your central nervous system, is one of the most important. So thank you so much for talking to us about all this important stuff. If you guys have any questions,
I think
please,
there are a few.
Yeah, I'll come over and I'll read them out.
Okay.
We'll just
All
see.
right.
All right, Melissa Gibbs. Hi, Melissa. Are there any possible complications to the baby from doing an alignment during pregnancy?
Great question. So if you're going to someone who is trained to take care of pregnant mamas, then the chance of that is no. There's always a chance of anything happening, but we're not doing things to or with the baby. We're working around that area. We do a little bit with some muscle work over to the side, and then we have a handy pillow that lets you lay on your tummy.
Yes.
Which is
Yes.
to work on the pelvis. So we're not doing things directly or even right beside baby necessarily.
And the adjustments we do are very gentle as
Very
well.
gentle.
So it doesn't take a lot of force to move a joint or a bone, especially in a pregnant mom, because of the relaxant. Everything moves a lot easier than it would prior to pregnancy. So the typical force that you may think of with an adjustment, you can reduce that back even with a pregnant mom. So it's a very gentle adjustment.
as with most stuff, the things that you see on TV isn't actually how it
Yeah.
happens in real
Right,
life.
yes.
And if I can speak on that a little bit, just being pregnant, I was really nervous about that. I'm like, oh, they're
Yeah.
gonna like snap me in half and stuff. But
Move my neck
it's
around,
so-
break it.
And they're so exact in their adjustments. They know exactly what they want to do, and they're very exact with it. And honestly, there are some days where a baby would be in such a funky position, I couldn't breathe, or there's so much pressure on something, and just adjusting that stuff around baby allowed him to have more room to get off of those things that I needed him to get off of. So really, it's super gentle, and I never saw any negative baby movements from it. It was mostly positive. It was getting him off of things so I can breathe, or less pressure on like my right side and things like that. So really, they're just helping you have the most room you can have for your baby to kind of be in a position that's comfortable for them, and they're not going to get into a position that's uncomfortable for them for very long anyways before they want to move. So if that's helpful at all.
She needs to be your spokesperson.
I know.
Yeah.
She's got it down.
Very well.
Okay.
Oh.
We should have brought your little handy tool in to show everyone.
We can.
Do you want me to go grab
Yeah.
it?
Yeah, I think that would be great to show everybody, because my misconception has been like the
Right, like
the
crack your
neck breaking, and
Yeah.
I have a lot of neck issues, so I'm like, please leave
yeah.
it intact.
There are a lot of different ways to make the adjustment. So the one we do is not as common in this area. So it's nice to know that there are other options.
Okay. So you want to demonstrate the?
Sure. You would use this guy,
Yeah.
our nameless friend.
Nameless fun.
Name him.
Her.
Or her.
It's gonna be the hashtag.
It's probably a
for the
her.
Name that spine.
Right. So there's a lot of different techniques in chiropractic. The one that we use is called, I don't know if my head's in here.
Yeah, you're
It's-
good.
It's called the activator technique, and we use this instrument here. It's called the activator to make the adjustments. And so it's a spring-loaded instrument, and there's different forces that we can change. So 1 to 4, 1 would be for the lowest setting, and 4 would be for the bigger bones, like in your low back and your pelvis. And so we can change the force needed for the specific area that we're working on. So just as an example, so we use this spine here, the unnamed spine. And so let's say that if one of these vertebrae are out of alignment, then what we do is we come right here and we use the instrument, and it makes a clicking sound, which sounds worse than it really is.
Yeah.
It's a
Yes.
very, very gentle adjustment to help kind of,
Basically just kind of thumps things back into
yeah,
alignment.
for lack of a better word. So this is the instrument that we use, and we do work with the muscles and ligaments, usually by hand,
Yeah.
but there's no traditional adjustment that we do. Not to say that you can't get a traditional chiropractic adjustment for a pregnant mom. We specialize in this
At this
technique.
office, we don't.
We do.
Yeah.
So nothing against the other technique, just this is what we like to use. Just
This
want to
is
throw
what
that in.
works.
Yeah.
Yeah, is there any other questions?
No, there's no more questions for now. I'm sure we'll get some later and then we can
I just thought about this, but Dr. Daniel, you're starting to do more of that kind of acupressure type stuff with some of your moms. Do you want to talk a little bit about that and just what you're doing with that lately?
Yeah, so there's a lot of information out there about acupressure, acupuncture with pregnancy. Right now, until I'm more certified, we recommend Dr. Guman, I think, is an acupuncturist in the area that takes care of a lot of our pregnant moms. And so for acupuncture related conditions, he is the expert. I do just a very, very little bit to kind of help. Once we get to around the 40-week mark, we want to do anything we can to just kind of help stimulate things, to get things going. And so if acupuncture is something that can help, then that's something in the future that I'm learning. But right now, I would refer to Dr. Guman.
Cool.
We'll list his info as well.
Yes.
That way
Yeah.
you guys have it.
So maybe someone later on to go talk to about what he does with
Yeah, that's
Yeah.
great.
pregnancy.
Great
So
point. We'll add that to the list.
yeah,
Yeah, there's lots of things out there as far as body work when it comes to
Yes.
pregnancy.
absolutely.
Chiropractic care feels like is one of the most important things because they're going to adjust everything to where it's working great. Then you're going to go get a massage or you're going to do some other things, and it's just going to kind of support the work that they're doing for you. So
Right.
chiropractic care feels like the mothership of taking care of yourself during pregnancy, and everything else kind of branches off of that. Yoga, all those things that you can do. If your body's not aligned properly, doing cat-cow isn't going to really it's not going to really feel awesome. So that's really great. We really appreciate you guys
Yeah.
taking
Yeah.
time.
Sure.
We're really
Thank
busy.
you so much.
Again, if you guys have any questions, please contact these guys. I'm sure they'll answer any questions, and come see them and talk to them about how they can help you, because they certainly can.
For sure.
Yeah. Thank you
Well,
so
thanks,
much.
thanks for having us today.
I will.
Bye, everybody.
Signing off.
Yes. Bye.